All right, myocarditis is an inflammatory, acute, or chronic disease process involving the cardiac myocytes, which are the cells that make up the myocardium or the heart muscle. And this most commonly occurs from a viral infection, most commonly an enteroviral infection. And what occurs here is you get dysfunction that occurs from that inflammation. So the inflammation occurs, basically causing necrosis and degeneration of those myocytes, so the cells actually will die off, and that can create a cardiac event. And many times physical activity actually triggers this. So an active individual, a lot of times while they're participating in activity, if there's the potential for this, it could possibly set this off. So again, this is another cause of sudden cardiac death that could occur. If you look in your textbook, in addition to the signs and symptoms, there's specific red flags that could hint you off to something being myocarditis. So many of the early symptoms could be very similar to just what is thought to be just a general viral illness. So if you think of like influenza, the common signs and symptoms associated with that are a lot of the early things that could happen with myocarditis. So that in conjunction with some other red flags, if they come up, the person would want to be assessed for possibly having this. So congenital aortic stenosis is a condition that involves, it's a pathology involving the aorta. It's most commonly related to a bicuspid valve malformation. I have an illustration of this on the next slide. So the pathophysiology comes from this, from an impaired left ventricular outflow with a compensatory hypertrophy of the intraventricular septum and left ventricular wall. So what happens here is the patient could possibly develop a myocardial ischemia, okay, or a decrease in blood flow to the myocardium due to the left ventricular dysfunction that actually happens. So this could result in a lot of other cardiovascular related complications due to the fact that the blood flow leaving the heart is not normal. So here's a picture kind of showing what would happen. Again, on the left side of the screen, you have the normal heart. On the right side, you have the heart with the aortic valve stenosis. So you see the thickened wall of the heart that's going to occur because it has to work so hard to kind of get blood flow through the aortic valve. If you look at the aortic valve, it's kind of closed off because of changes that are occurring within the vessel. So, and again, this could cause then some of the complications that relate back to many of the signs and symptoms that would occur with somebody that has an aortic valve stenosis. Okay, so we talked a little bit about mitral valve prolapse as it could be a condition that occurs with Marfan syndrome, but this is also something that could occur on its own. It's one of the more common cardiac abnormalities, and it's primarily seen in women. It is sometimes mentioned as a cause of sudden death, but reports of sudden death just due to mitral valve prolapse are pretty rare. Many times, particularly in patients who are asymptomatic or who don't have active symptoms, who may have a slight mitral valve prolapse, are usually allowed to participate without any restrictions. If individuals are symptomatic, meaning like they have some of the symptoms associated with mitral valve prolapse, they may need to be given a treatment. Particularly what they'll typically do is give them an antiarrhythmic treatment to treat any type of arrhythmia that could occur. So typically what you would see with this, if a person doesn't realize they have one, if they are symptomatic, sometimes they'll complain about feeling like they're going to pass out, or for that matter, they may have syncope related to this. So, but a lot of individuals are still able to compete as long as they don't have a family history of sudden death in the family due to a heart problem, or if they don't have any type of like major mitral regurgitation, so if it's not considered a moderate to severe, or any type of syncope caused by arrhythmias, they're usually allowed to participate in sports without any restrictions. Okay, arrhythmias, and we're going to talk about some specific types of arrhythmias, but an arrhythmia is any time that there is an abnormal heartbeat due to the electrical pathway of the heart being disrupted. Many times they can reoccur and possibly disappear. Many are benign, so a lot of times athletes will have benign arrhythmias that are just due to increased vagal tone, and many of them actually disappear with exercise. So the concern with this is that a pathological arrhythmia can compromise blood flow and blood pressure, and in some instances result in sudden death. But there are benign arrhythmias. So for instance, there's a benign arrhythmia known as a premature atrial contraction, where the electrical conduction pathway causes a contraction of the atria that may occur sooner. That would be an example of a benign one, where many times the athlete can still participate in activity, without any type of restriction. So we're going to go over some specific types of arrhythmias that are talked about in the chapter coming up. So Wolff-Parkinson-White syndrome is an example of an arrhythmia. It's caused by ventricular pre-excitation and tachycardia that results due to electrical conduction over accessory pathways. So what this means is that an individual will actually have an extra pathway. So when you looked at that, the illustration we talked about earlier, kind of showing what the electrical pathway of the heart is, somebody with Wolff-Parkinson-White syndrome actually has like an added pathway that causes the ventricles to get kind of stimulated a little bit earlier. Okay, it occurs in about 0.1 to 3% of the population, and what you have is when you look at the EKG, it's characterized by a short PR interval and a prolonged QRS complex. So that's what they would typically see on the EKG. The incidence of this with athletes does tend to be very low. One of the possible treatments for this is surgery. There's some other options out there, and usually the surgery is done to kind of correct the added pathway with this. If an athlete with this is asymptomatic and they're over age 20 and they don't have any type of structural disease, they will be unrestricted. So someone could possibly play. Again, with some of these conditions, it just kind of depends upon other factors. So, I just gave an example there, and again, look further at the treatment and return to participation for that to see where and when there would be restrictions with this. Okay, long QT syndrome, this is another one. So this is a ventricular repolarization abnormality. So this is, again, QT prolongation. So again, if you remember the EKG we showed at the beginning, it can be idiopathic or can actually be acquired. So it could be something that they are born with. It affects 1 in 2,000 people. Low rate of death in athletes. However, people can be at high risk for syncope and ventricular arrhythmias. So there's some different variations in this condition, but again, just know that again this is a form of arrhythmia and where it actually affects the actual heart rate. So here's what a electrocardiogram for someone with long QT syndrome looks like. So it's just what they say. So you look up there and you see the QT interval. It's a lot longer in someone with long QT syndrome, and again, that's just what basically causes. So again, you think about athletes, they're going to have elevated heart rates when they're playing, and when you're looking at the rhythm of the heart, that's where that can kind of get disrupted with increased levels of activity. Okay, syncope itself, or just passing out. Again, this could be caused by just a very benign condition, or it could be a more serious condition. So anytime you have an athlete that just has a bout of syncope with no apparent reason, you have to find out what the cause is. Okay, so many times it could be just very benign with what's called a vasovagal reaction. So that would be something, but it could also be it could be something life-threatening. It could be caused by hypertrophic cardiomyopathy. So you got to find a definitive cause as to why it happened. So basically, if someone complains of syncope, or you witness someone fainting and passing out, and you can't really figure out why, then they would have to get referred and looked at anyway. So one of the more frequent things are neurogenic. And again, that could be caused by a vasovagal response, but many times they will still have to be tested to see if they have any type of possible cardiac condition that could possibly cause death if not treated, or if they're not removed from activity. Okay, hypertension. So systemic hypertension is a very common disorder to have. If it's not treated, it could lead to many serious conditions. It could lead to heart disease. It could lead to atherosclerosis, renal disease. So basically, again, the reason why we have blood pressure is to maintain perfusion of throughout our circulatory system. So as our blood is up against the vessels, that's what's allowing for oxygen to diffuse into our cells and organs and tissues in our body. But if blood pressure is too high, it could cause damage to the structures. So in other words, it puts too much stress on that system. So think about if you had a hose with water running through it. Well, if the water is put through at a pressure that's too much for the hose to contain, it's going to damage the hose. Well, it's the same thing you have as with the cardiovascular system. So that elevated blood pressure, if they do have it, it means that basically that will increase overall peripheral resistance. So it could possibly put strain on some of these issues. Okay, so again, normal is less than 120/80. I had given the new guidelines as far as what is considered hypertensive. So elevated blood pressure is 120 to 129 over less than 80. Stage 1 hypertension is 130 to 139 over 80 to 89. Stage 2 hypertension is 140 over 90. Someone is deemed in hypertensive crisis if they're greater than 180 over 120. That's considered a hypertensive crisis. Hypotension, okay, so we talk about hypertension, but you could also have blood pressure that's too low. So if the blood pressure is too low, now what happens is you're not getting that gas perfusion for the oxygen into the cells and the tissue. So less than 90 over less than 60 would be deemed to be, a person would be deemed to be hypotensive. And the most common malady you would see from that immediately is the person would feel very lightheaded and feel like they're going to pass out. So that's usually a sign that they could have very low blood pressure. So a deep vein thrombosis, or DVT, that's a condition where a blood clot, or what's also called a thrombus, becomes lodged in the large vein. Okay, so many times this happens in the lower legs, primarily because if you think about it, the blood from the veins have to come up, superiorly to the heart. So it's a lot easier for this to happen in the lower extremity. It can occur in any limb, though. It can happen in the upper body as well. It has been reported in baseball pitchers. So this is something that can happen in the upper extremity. It's just much more common to happen in the lower extremity. And you see this many times, particularly after a trauma. So the combination of the trauma, and then many times with the trauma to the lower extremity, you get immobilized. Well, if you get immobilized, that makes it a little more difficult for that blood to come back up through, because remember, the veins, in order for circulation to be assisted with the veins, you need to have muscle contraction. Well, if you don't have that, there's a much greater chance that the blood flow slows down, and you already have kind of damage in there anyway. So that makes it kind of very advantageous for that clot to form. So we have a picture on the next slide just kind of showing you again how this would happen, but that's essentially what happens with the deep vein thrombosis. So here's a picture. So again, it's showing you the vein. Now, you remember that again, veins need the muscles around them to help contract. So, many times for an athlete or a patient even to get this, there has to be usually some sort of precipitating factor. So if you look at the picture here, what would end up happening is, if there's some type of trauma to the body that causes the bleeding or damage or even damages the vessel, if for some reason that blood flow gets kind of slowed down, what it does is it causes the platelets to kind of bunch up and causes the clot. And many times, as you see in the picture, one of the kind of hallmark signs and symptoms of this is distal to the clot, you'll see swelling. So if you look at the lower leg on this picture, there's distal to where the clot has taken place, it swells. Now, sometimes the clot can travel, and that's what we're actually going to talk about next. So one of the complications of a deep vein thrombosis is that the clot can actually break off, and you can get, once the clot travels, it's then what's called an embolus. So we're going to talk about what's the common complication with an embolus once that clot kind of breaks off and starts to travel through the bloodstream. Okay, so again, as I had talked about, so when the thrombus, which is the blood clot, travels through the body, it then becomes an embolus. So a pulmonary embolus is the complication that I was previously alluding to, and that's when the blood clot actually travels. So eventually what could happen is that blood clot can actually break off and then travel through the circulatory system until it gets stuck somewhere else. And one of the areas where it can get stuck is in the pulmonary blood vessels. So obviously the issue there is a possible disruption in the gas exchange. So many times what can happen is if the gas exchange gets interrupted long enough, obviously an individual can possibly die, and that could happen before the clot actually gets dissolved. So the body will still try to dissolve the clot, but many times it doesn't happen fast enough. So many times, and where we see this in active individuals, is that in some people they can have a hypercoagulability response to a trauma. So, someone gets hit and what would just maybe be a basic contusion bruise in, say, the lower legs. Well, maybe the trauma was hard enough or severe enough, and or they just have this hyperactive response where instead of just having a basic clotting response, they get an increased response, and then they end up developing the blood clot. So you see this a lot of times there. This sometimes can be an issue when athletes travel. So if athletes, if they travel far distances and they're not moving their legs for a while, sometimes this can randomly happen as well, even in the absence of trauma. So that's something you have to be aware of. I know I've heard stories of athletes, traveling, they're on a plane for a long period of time because they're traveling somewhere far away, and they randomly develop a DVT or a blood clot. And obviously, again, this could kind of be a result of that blood clot if it were to travel. So the deep vein thrombosis is the thrombosis, or the thrombus rather, is the blood clot that occurs once it travels. It's then deemed an embolus. So here's a picture kind of showing you what would happen with the pulmonary embolism. So you see the lungs, which we had shown previously in class, and you can see the breakout. So the pulmonary artery, which, remember, the pulmonary artery actually carries the non-oxygenated blood. But basically what happens is that embolus, that now traveling clot, could get caught anywhere in there, and once it does, it can disrupt gas exchange to the point where the person could possibly die if this isn't dealt with soon enough. Again, the body will try to dissolve it, but sometimes it just takes too long for the body to just dissolve on its own. All right, peripheral artery disease. This is something that's also called peripheral vascular disease. It's caused by atherosclerosis. So, the arteries kind of getting blocked up with the lipids in the bloodstream. This is usually something that is in older individuals. Younger individuals will not typically have peripheral artery disease. So it's usually present in people who are older than age 50 and many times have some other type of risk factors. So the risk factors being smoking, hypertension, diabetes, high blood lipids. If this happens in the heart, it's there's coronary artery disease in the heart. So as opposed to it being in the heart, now it's just in the periphery, and the signs and symptoms associated with kind of like lack of blood flow will be many times present with these individuals. Okay, looking at anemia. So anemia refers to a decrease in the number of red blood cells or a decreased hemoglobin concentration in the blood. There are various types of anemia. Some other conditions do cause anemia. So one of the things is if an athlete's showing signs and symptoms of possibly having a type of anemia, it's important for them to rule out other conditions. For instance, certain types of cancers can actually cause anemia, but sometimes the anemias can occur on their own. There are different types. There are true anemias, and there are anemias that are considered not true anemias, and I'll show you an example of that coming up. Many of these disorders are more common in endurance athletes, particularly females. So I had mentioned how there are a difference between true anemias and not true anemias. So the true anemia is one of the most common ones, the iron deficiency anemia. Okay, so iron deficiency anemia is just that they lack the iron. It's going to cause a problem with the red blood cells and their ability to carry oxygen throughout the blood. An example of anemia that's considered not a true anemia is the dilutional pseudoanemia, or also what's known as a sports anemia. That is something very common in endurance athletes, and what happens there is that the amount of red blood cells circulating is actually a normal amount, but what happens is their plasma volume is increased. So relative to the plasma volume, the red blood cell concentration is actually decreased, but they actually have a normal amount of red blood cells, okay? So that's actually considered not a true anemia, or what they also call a sports anemia. So there's a couple other different types that are discussed in the chapter. Okay, they talk about the exertional hemolysis, so take a look at that as well and be aware of the mechanism by which that occurs. A condition that actually is categorized as a type of anemia is hemolysis. So this is where red blood cells break down as a result of activity. Many times this is reported in runners, and they also refer to this when it happens in runners. They refer to it as foot strike hemolysis. And the reason why it happens is obviously because of the amount from the feet constantly hitting the ground. You get the breakdown of the red blood cells in the body. However, it has been seen in other sports, but that's where it got its name from, with the foot strike hemolysis, or foot strike. Some people call it foot strike anemia. And again, this does result in anemia because of the decreased iron stores from the red blood cells getting broken down. Typically, many times individuals who have this are asymptomatic, and many times all the individuals end up having is what's called a microscopic hematuria. So what happens many times is hematuria is when there's blood in the urine. So sometimes, for whatever reason, if an individual is having their urine tested for something, it may show up that they have small amounts of blood in their urine, and many times it's because they have this hemolysis going on. However, it could be asymptomatic, and it may even be something that isn't even causing a problem for them. So that's something to bear in mind as well. So the urine actually contains this because of the intense training that they're actually taking. So as long as they don't have any other symptoms of it, then it's not really a problem, and there's no restriction on sports. Okay, sickle cell trait or sickle cell anemia. So now these are two separate conditions. Both of them are caused by a genetic defect in the hemoglobin. So what happens here, and if you look at figure 816 in your textbook, shows you what a normal red blood cell and then what a sickle cell looks like. Okay, now these are two separate conditions. People with sickle cell trait have an abnormal gene from one parent and a normal gene from the other. Those with pure sickle cell anemia have the traits from both. So in the individual that has the sickle cell trait from both parents, they have cells that are sickled all the time. So they constantly have these abnormally shaped red blood cells circulating throughout their body. Whereas an individual with sickle cell trait, they will only sickle, if you will, under certain conditions. So this becomes a concern with athletes participating, particularly in hot weather. A lot of heavy physical exertion in hot weather can possibly trigger them to end up having sickling occurring, and then possibly the ramifications, the different issues that could occur because of that. So with this condition, again, I highlight this with a lot of different stuff, but take a look at the prevention things that go into individuals with sickle cell trait. This is a condition that's kind of been highlighted in recent years because of there have been some even high profile deaths from this in athletics. So take a look at the prevention stuff for this along with the treatment, because it's important to note this. It's probably more so important to be aware of the sickle cell trait information from a practice perspective, because athletes with pure sickle cell anemia probably will not be able to participate in sports. Physically, it will be very hard for them, an individual with sickle cell anemia, to participate, but people with sickle cell trait can. Okay, so the first step is knowing what the difference between the two types of sickle cell conditions are. Then for sickle cell trait, what are some of the prevention things you can go through to prevent somebody from having a sickle cell crisis? Your textbook outlines both the red flags and the prevention for that. So go through and make note of that. They're just some simple steps. Again, if you just kind of know what causes the condition, the prevention for it, when you read that, it's very intuitive and makes a lot of sense. So those are the cardiac conditions. Again, as I said previously, please make note of the treatment and signs and symptoms. Any type of red flags and differential diagnosis would be important to make note of as well.